Welcome, everybody. Um, Day number 2 of the Knowledge Festival #1. So we had a great day yesterday. For a starter, I would say. So we had 2 paper presentations on the basic development of the immune system. Actually, in children, according to Siddha medicine and in Ayurveda. And then we had a nice discussion round with our experts. And you can find everything on our YouTube channel. And you can subscribe and click that little bell so you will be notified every time there is new content on. Right now, we will have daily content, so maybe you just keep your YouTube going. Aside from that, today we're moving on from the basic development of the immune system. As you can see on our website each day what the program will be. So today we're going to the components of the immune system. Also, again, just like with everything, looking at a certain topic from different points of view, from different systems. This will be the first part. Just each part is always the same. It's depending on the day, 2, 3, 4 papers are presented, and then there's a short break, and then we have a discussion round with experts on that topic, and then we'll have a break, 12:30 Middle European, Central European time, so for an hour, and then we'll have the second part of the day, which is about understanding the immune response. So again, the same procedure, a few papers by our presentators, and then a short break of half an hour, 20 minutes, half an hour, and then we'll have a discussion round with the experts going through a set of questions that they will reply to from the standpoint of their medical system. So this is the program for today. Today, part 1, as I said, is the components of the immune system. And we have a few papers prepared for you. So, Dr. Geeta, are you there? And
yes, sir. Good afternoon.
good.
How are you all?
Thank you.
Thank you, ma'am.
Very good. So
Can you hear me, sir?
I can hear you. We hear you. I think everything's fine with your voice.
Okay.
We have no video of yours, but that's okay right now until we go up. I will give you the co-host. So
Yeah.
go ahead.
I think I can switch off the video if you want to, and
no, as long as your presentation is fine, as long as your internet connection doesn't suffer too much, it's fine. We like to see our guests. It's not that
yeah. So I'll be sharing you the PPT. Okay.
Right.
Okay. Share. Okay.
Very good.
So,
Can you put it in full screen, ma'am?
yeah, I hope you can see the PPT.
Yes, ma'am. Yeah.
Yes.
Yes,
Everything
yeah.
here.
So good afternoon, everyone. My topic is integrated acupuncture and naturopathy module in the management of polyarthritis. It's a case report that I'll be presenting today. So what is polyarthritis? Mainly, as we know, poly, it means many. So polyarthritis is a condition or arthritis of the joint pains that affects more than 5 joints simultaneously. And basically this polyarthritis is associated with autoimmune diseases. And if we see the prevalence in autoimmune disease, it affects around 0.5 to 1% in Indian population, and most like greater incidence is seen in women. It is more than 3 to 4 times greater than in the men. And generally, if we see the onset of the disease, it's nearly in the middle age that it starts. And there are many factors that contribute to this, because like there are functional limitations are there. It leads to disability, and it also causes comorbidities and reduces the quality of life due to these all disabilities. Okay. Mainly we have, this is a single case report that I'm presenting. Here we had a female patient of 65 years old. She came to our hospital in an OPD with she had chief complaints of pain in the left shoulder, left elbow, and left wrist, even in the left fingers, ankle, and toes. And this was associated with swelling in the wrist and in the ankles and even in the fingers. And due to the swelling and pain, there was restriction in the range of motion of wrist and fingers. She was not able to make a fist, and she was continuously complaining of that she cannot make a fist, she cannot lift her shoulder, and that was causing disability, or that was hindering her daily activities. And when we assessed, we used visual analog scale for assessing the pain and swelling. And as we assessed, she reported that her pain scale was around 6 by 10 if we compare 0 to 10 as our pain scale. And for swelling, it was 7 by 10. And she was under allopathic medication. Actually, she had been suffering since 6 months with these problems, but she was taking allopathic medications and analgesics and some anti-inflammatory medications. But after 3 months, as she didn't get any relief, she was only taking analgesics on and off, but she stopped all other medications. Then she was explaining that she had really she was having difficulty in her daily activities like dressing up, taking bath. And she was since her age was 65 years old, but living in a family, like she had her family together, but still she tried to do her daily cooking and all, but she had difficulty in doing that. And due to that, she was quite frustrated and her confidence level was getting low. And because of that, she was avoiding these social gatherings and all. She and this was again during the COVID time, so she stopped going out because of all these problems. Okay. And what was the materials and methods that we did? Basically, we did this study in Sant Tridaram Yoga and Nature Care Hospital. It is the teaching hospital for our Sant Tridaram Medical College of Naturopathy and Yogic Science for Women. It's our teaching hospital. And we did this case study there. And then what we have taken the method and according to the care checklist. And here we did the clinical diagnosis. We assessed her weight, stiffness, and gait analysis. Then for laboratory diagnosis, we used basically ESR, C-reactive protein, and rheumatoid factor for our assessment, apart from the normal lab investigations. And for instrumental diagnosis, we use visual analog scale for pain and swelling. And to assess quality of life, we used WHO QOL BREF questionnaire to assess the quality of life. Basically, we treated her in an outpatient department because she didn't want to get the admission. So she was coming daily in the OPD and taking the treatments and going back home. But a proper diet chart was prescribed to her, and she was following that. Initially, we started with a treatment that is our naturopathy intervention. Okay, so we gave first for 7 days, for 1 week, we gave naturopathy treatments, and that included of like steam bath. That was in a week we gave 2 times, and 7 minutes. The duration was for 7 minutes, and a partial massage to legs and arms and abdomen. That was given for 20 minutes, and we use mustard oil because mustard oil has heating property that helps in reducing the pain, and it was given for 2 times in a week. Then we were giving her arm pack and leg pack. In arm pack and leg pack, what do we do is like we use Epsom salt. I think Epsom salt pack. How it was done was that the linen cloth was dipped in Epsom salt water. It was rinsed properly and was tied all over the arm and leg. And over that, we were tying the woolen flannel, and that was given for 30 minutes, and it was given daily for a week. And with that, hot arm and foot bath, that was also given with the Epsom salt. The water we added Epsom salt in that, and the patient was asked to dip her arms and foot in the Epsom salt, and then water with Epsom salt. This was given for 20 minutes, and this was given 5 days in a week, and the 2 other days she was given steam bath. And enema is one of the detoxification procedure that we use in our treatment, like in naturopathy. So enema was given for 2 times. Okay, we use neutral water for that. And after a week of the treatment, actually lockdown, there was lockdown, so we could not proceed with the actual treatment with the naturopathy treatments. But like she was not able to come to our hospital, but I prescribed her the treatments like Epsom's hot arm and foot bath and leg pack, these at home. So I was continuously following her up and calling her, and I had given her a proper diet prescription so that she could follow at home. And the treatments, like weekly, 3 times a week, she had to do this Epsom salt hot foot bath, and then leg pack and arm pack she was advised to take every day. So after 5 weeks, again our hospital was open. So again the patient came, and we started with acupuncture. Basically what we had planned protocol was first naturopathy treatments, and then we would include acupuncture. So due to lockdown, but she had followed up very religiously. Yeah, she did all the treatments and the diet follow-up. She did very well, followed very well. And after 5 weeks, she came to our hospital. Then we started with acupuncture. So acupuncture, as we acupuncture was given for 10 days and 30 minutes daily. The points were punctured, and the needles were punctured in particular points, and point selection was based on TCM, a traditional Chinese medicine. And here in TCM, what they refer polyarthritis is as bi syndrome. And the major pathogenic factors behind this BI syndrome was wind, cold, and dampness that contributes mainly to polyarthritis. But seeing the clinical signs and symptoms and taking detailed case history of the patient, she was diagnosed as BI syndrome that was induced by dampness and heat with severe poly joint swelling. So that was what we analyzed, and the points were selected based on this diagnosis. So this is our treatment protocol, or the timeline. Like, she came to our hospital on 30th March, and where we did the admission or registration, and baseline data was taken. And then from 31st March to 6th April, that is the first week that we started with naturopathy intervention in the OPD. Then there was a 5 weeks follow-up, and then she came back to us on 3rd June, and then we started with acupuncture, and that acupuncture was given for 10 days. So on 14th June, we took her post data. Then we analyzed. These were the results after taking this treatment. So when she came at the baseline, her weight was 52. And after this treatment, it was 54 kgs. And then on pain scale for VAS, it was 6 on the baseline. And later on the 10th day of acupuncture, it was 3. And for swelling, it was 7. And then it came back to 3. Then we assessed her quality of life questionnaire, and there we could see the changes that she had. So her physical and psychological impact was 50 as a rating in baseline, and it came up, improved to 69. And her ESR lab investigation, what we did was for ESR was 48, and it came back to 35. And RA factor, it was 11.45, and it came to 5. And this remarkable changes was in the CRP, that was 29.39, and what it came was 0.8. And this we can see in the picture itself. This is on the first day when she came to our hospital. This was on the first day. You can see swelling. Her hand was full swelling. Or here it was on the 10th day, that is on 14th June when we took the picture. You can see that swelling had remarkably reduced. And so all these results show that, yeah, naturopathy, integration of naturopathy and acupuncture together, it has improvement in polyarthritis. That is, again, polyarthritis is an autoimmune disorder. So here we are talking about immunity. So these treatments and the diet that has been prescribed to her has helped to improve her condition. So as we can see by the results itself, significant improvement were seen in the studies, in the result variables. And this study, we can say that there is strong positive effect of integrated naturopathy and acupuncture protocol on the health outcomes of polyarthritis. And what are the limitations? Yeah, limitations is there, that it's just a single case study, and we need to inculcate this in a large group of patients. And we also lack this video documentation where we could show the marked prognosis. And there are many studies that support that. There are many studies that have been done in the impact of naturopathy and acupuncture in RA patients, which is again an autoimmune disorders. And there are many evidences seen that acupuncture really helps in RA patients, which is autoimmune disorders. So here, our case report, it suggests that there is integrated naturopathy and acupuncture is well tolerated and clinically beneficial in the treatment of polyarthritis. However, we have to take like study. We have to do a large scale study and we can implement in further studies. Well, thank you for giving me an opportunity. It was really great being in this board and also presenting this. I really thank you all for giving me an opportunity.
Thank you. Dr. Gita Sharma, who was also on yesterday on the I didn't read out the title of the paper of the integrated acupuncture and naturopathy module in management of polyarthritis. It's a case report. So one or two things that I would like to hear from you. One is, you said that one of the limitations is that there has only been one case study up to now. Is there any plan for a bigger case study?
Yeah, actually we got this, like seeing the result of the patient. Yeah, it is a single case study that we have done here, but we are planning to like see the result inculcating both integrated acupuncture and naturopathy module in larger scale. So we are thinking of doing a larger study. First we'll go for a pilot study and then see the results. And obviously there are research is done on RA. So obviously there is a good result. Obviously we are optimistic that we'll get good results in this study as well. So we'll be planning it first for a pilot study, and then we'll go in a larger scale.
Well, that would be great, I think, because, you know, in Europe, or in the whole world, Western world, arthritis is actually kind of a lifelong issue. Once you have it, you know, you die with it.
Yeah.
So would you say that you can completely heal this ailment, or is it something that you can reduce, but you will still have to live with it?
Actually, like we have seen the results in RA or in other, like the diet what we prescribe to these kinds of patients, like mainly starting with this case, she had CRP level was very high, so we started with a protein restricted diet and with anti-inflammatory diet. Like in naturopathy we inculcate different diet procedure, that is fruits and vegetables. In that, like pineapple juice was one of the most important juice what we inculcated, because pineapple juice, it has anti-edematous and anti-inflammatory property, as it consists of bromelain, which is really good for reducing the inflammation. So we had prescribed the patient with these pineapple juice daily, and we initially restricted protein, and we advised her to take most of vegetables and fruits. So that helped her in reducing the inflammation and the CRP content. And along with that, we are giving her the treatments, and along with that, acupuncture. We have seen results that there are studies that that have been conducted on giving stimulation to stomach 36. That is one of the anti-inflammatory points, or immunity enhancing point. So apart from that, we have to see the basic what is the diagnosis according to TCM, and we can inculcate. So this has reduced the inflammation, and to sustain the same the same prognosis. So this has helped, and we can say that, see, arthritic conditions, if you say osteoarthritis, it's an aging process. So we can reduce the degeneration. Okay, we can reduce the degeneration, we can enhance the circulation around the joints, and help in like proper nutrition can be provided. Okay, so we can prevent the further degeneration. But in inflammatory condition, we can reduce the inflammatory conditions and we can prevent that.
Okay, so because this might be a very huge thing for, as I said, for the Western world, because with the modern medicine, it seems to be mostly a something you can work on with certain drugs, or just a lifelong issue that you carry with you. So I guess eating pineapples every now and then would be a much nicer approach than filling yourself up with chemicals. So thank you for that. Just a final one. Would you say there's a difference age-wise? So is it will this work in a way better for younger, older people, or is it just for everybody according to their body?
If we see that in the olden age, like as the age advances, obviously body's immunity decrease if you don't properly maintain your lifestyle. Okay, so prognosis is better seen in the young adults or young than in the old age. So yeah, prognosis is better in the young adults than in the old age. So age does matter in whatever the treatments we prescribe and all. So in this case, she had stopped taking analgesics after we started with the treatment. So that was a great achievement for us.
Right. No, I mean, it sounds great. It would be great to see a wider case study and research on this, because I think this is something that many people, especially the older people in the Western world, are dealing with, and it could be very helpful. But for now, thank you. It was a great presentation, a very interesting topic we got there. And as I said yesterday, hopefully we can get you on a personal talk on something that so that we have more time to go through some ideas. And but we'll have this week to share some ideas, and then later on we'll see. So for now, thank you again.
Thank you so much. Thank you so much. Thank you, everyone.
We'll go to our next paper. Let me see who we have.
Dr. Senthil should be here.
All right. Just let me. By the way, for all the viewers, I might be, I might be looking like a madman here, looking from left to right and all that. It's because I have to go, from this screen to that screen. I have 3-4 screens here in this little studio to handle all the information coming in, to handle the stream. So bear with me. My apologies for making everybody sick when watching my image. So we have Dr. Senthil here, who will present a paper on Siddha, immunity, and gut microbiome. So We have had this this topic with the gut and the whole system. So this will be very interesting. Doctor?
Yeah. Greetings, warm greetings to all the experts and the participants from Chennai. Myself, Dr. Senthil. Can you hear me, sir?
Yes.
Yeah. Myself, Dr. Senthil. I am a research scholar and I am a Siddha practitioner practicing in Chennai for the past 10 to 12 years. So I like to present the immune component that is the major topic of this current scenario. What Siddha says, what we deal, or what we see as an immune in Siddha system. Let me discuss about this. I ask the host to share.
Yes, you have the rights. So just go ahead.
Thank you.
Wes, I think you have to share the slides, I think.
I see. 1 second, sorry. I just have to get them. I thought it was going to, which one is that? So this is the, sorry, everybody has to wait for me, but I don't have it, it seems. Let me see. Oh,
Check again.
Maybe. Vinayak, you have this one?
I'm looking, yeah.
Because
if you want, if you make it the co-host, I can share the slides.
yes, I can do that. So a very good idea. Go for that. Now, there you go. All right.
Just tell me, sir, when you want to say next, I will change it.
Great. Now we have the thing up.
Yeah. Is it audible? Shall I start?
Yes, everything perfect. Now you can go on.
Yeah, thank you. And blessings from my guru and my teachers. I start this one. And here we see that the trend of immunity in Siddha and the correlation of gut microbiome and how it has been already portrayed in the Siddha literature. Next slide one. Health in Siddha system of medicine, health is defined. Health of an individual is defined as an harmonious and the balanced functioning of Tridosham. Under the roof of Tridosham, we have three bioregulating forces, that is Vata, Pitta, Kapha, which is the sole responsible for the creation of an embryo to the death of a human life. So when we come to immune factor, what immune factor has been quoted in Siddha, we say as they have one mind. It is the physical well-being. The translation they have one mind is a physical well-being So it varies, depends upon the individual, because we have different constitution. We have 9 different constitutions, so that it differs. They have one mind, that is a physical well-being. It depends upon the individual constitution. Once the equilibrium, that is the imbalance in the equilibrium of tridosham occur, then they have unmay, and the immunity factor will be a challenge, and the disease evolves. Next. So here, fever is the immediate and the ultimate response of an immune system. We all know that. In Siddha system, we have term suram as fever. So we categorize suram in many types. It's more than 150 types of fever has been classified by our Siddhas. And we see fever as a disease, not as a symptom, as like of modern medicine, they see as a symptom, but we see as a disease. So in Siddha pathophysiological of fever, there is a mantra, that is a 2-line quote. We usually say like, Kudal Danil Seedam Aladu Suram Baradu, which means without formation of ama, that is mucoid toxin in the intestine, we won't get fever. So the ultimate cause and the commonest cause written in the literature is because of the ama formation in the gut. So the basic physiological factors behind the fever is 3 things. One is Dadragni, which is the Agni which are responsible for the digestion of the ingested food, and the Samana Vayu and the Anarpitta. That is the subtypes of Vayu Vatam and the subtypes of Pittam, which facilitates the ingested food to the taking to metabolism. And if the food is not properly digested, or if the ama has been created, that has been absorbed in the plasma, that is a first line of udal tadukal, that is the body tissue, and it carry out throughout the body, and it triggers the body immune system. There comes fever. So this is the simple pathophysiology behind the fever. So you know about how immune in fever is. Next one. What Siddha said, many pathophysiological textbook written by Siddhar Yugimani describes unhealthy food diet and the lifestyle pattern leads to ama formation. In recent, we used to tell like refined sugars, that maida product, biscuits and bakery items, tinned and canned foods, and refined sugars are the main food substance which aggravate the ama formation in the stomach and the intestine. So the chronicity and the chronic ama existing in the body GIT tract will ultimately lead to a chronic fever pattern, and that's become a metabolic disease or an autoimmune disease in adulthood. So acknowledging that principles, recent studies in New York done by the CDC people in COVID-19 victims, they found 48% of the mortality were in obese category. So that signifies the unhealthy food habits which facilitates the ama formation, and that leads to the mortality and the morbidity when treating the obese patient, especially in the COVID pandemic. Next. So ultimately, healthy gut is the only, that is one of the basic treatment guidelines every Siddha practitioner who follows. So depending upon the chronicity of the ama formation in the gut, we treat either, if it is an acute phase, we treat it with kashayams, kudinir, decoctions, extracts of the plants, and when it is a chronic pattern, like for a psoriasis, for a diabetes, or for rheumatoid arthritis, we give brechana, that is purgation, to eliminate all the ama from the stomach. And we, in the second phase, we give rasayanams and legumes to build up the body tissue and enhance the dehavanmai, that is the immune factor, to get out of this metabolic diseases or its autoimmune diseases. In children less than 5 years, mandam is a disease we usually commonly see in the practice. So mostly it comes only because of the food habits which they follow, like biscuits and all the tinned and canned foods. Because of that type of food lifestyle, they used to get this mandam. And we used to treat only with small plant extracts like omam, that is ajwain, that's trachus pomami, and noni, and such, that is Vitex nirgundi, such Kudini's decoctions helps a lot in treating the mandam patients. So we have a significant role of this Kudinis in treating this mandam. We can get rid of this disease within 2 to 3 days. So untreated or poorly treated mandam kids may lead to ASD or ASD pattern behavioral disorders in the future. It's a ascending one pattern which we observe here in recent days. Next. So in the last 15 years, especially in Tamil Nadu, India, we witnessed that Tamil Nadu peoples and the South India people has witnessed the effectiveness of Siddha medicine like Kudnir. This is a basic Nilavembu Kudnir, this is Andrographis paniclata. It is a traditional formulation which helps the total Tamil Nadu people to be protected from dengue as well as chikungunya, where we suffered as a great viral endemics. Now that Kabasura Kudinir, which helps protecting the people from the corona pandemic. So this is the only, this is the main 2 to 3 important Siddha medicine. Recently, we witnessed about the efficacy in a prophylaxis basis for this viral endemics. So having that in mind, Western people's, Western modern medicine now slightly showing the insight into the gut bacteria, what we already seen in the last slides, like they are slowly focusing the gut microbiome and the effectiveness in focusing of all the disease as well as in the immune system as well as in the behavioral diseases and cognitive disorders. For example, we see recently published in the journal, Nature journal, microbiology department has suggested they support, they insist that importance of gut in healthiness of mental well-being. And 2 more studies, which is, next slide. With 2 more studies, this is a study which is found that 2 important gut bacteria, which seems to be a good bacteria, which facilitates in reduction of depression in a group of people. And other study which is there's a correlating of a reduction in the dopamine, that is a neurotransmitters in a group of people who have quality of life. So and this and the other one is John Crayons, is a neuroscientist who works hard in this microbiome and about the gut-brain axis and showing the promising results of individual immune system against this behavioral symptoms of ASD and Parkinson and all. They keep on working on the gut microbiome to have a result, to have any pathway to get results to treat or solution for this type of Parkinson's or ASD type of diseases. So here we correlate that gut microbiome plays a major role when it comes to all type of diseases. So gut healthiness is a one thing which we need to be addressed, that our ancestors has been already clearly mentioned how to keep the gut healthy. So I conclude in the next slide. So the medical system states the importance and healthiness of gut and reduce harm of formation is a stepping stone and a healthy body and mind. So our authors Terrier has explained about Pini Anugaviri, that is, the line states that to keep away from disease is to keep the gut healthy by following good lifestyle and good food habits. So diet and lifestyles according to the seasonal variation suggested in traditional Siddha medicines, literature helps in keeping away from disease, even in such pandemics like Corona. So I end my session in this. Thanks to my Guru Palpandian Asan, and my and the Telegram group, Siddha Medical Medicine group, to help me to get this knowledge and to present in and before you. Thank you all.
Thank you so much. Well, let me, yes, Vinayak is finishing that. Great one. We had two really interesting papers right now, arthritis and the gut biomes, which is a huge thing also in the West. So thank you for that. Maybe I'm just looking if we have.
Dr. Senthil, please stay back for the discussion. I think it would be interesting to have you on board.
Sure,
that is an interesting topic. I think we are speaking about the gut microbiome. So
yeah, fine.
Please stay back. Yeah.
Yes. So for that, we will move on to the next papers. Thank you so much for this paper. And now we have come to the discussion part. It's about the components of the immune system. And as you can see on our website, knowledgefestival.org, whenever you go there, you see the whole program of the day. You can see who will be presenting papers and who will be part of the discussion. And today we have Dr. Mukesh and Dr. Senthil, Dr. Aleemuddin, and Dr. Subramania, and Dr. Abhishek Devikar. So we are very happy. I mean, they're from Ayurveda, Dr. Mukesh, from the Siddha medicine as Dr. Senthil, from Unani, Dr. Aleemuddin, from yoga comes Dr. Subramania, and naturopathy is Dr. Abhishek Devikar. Oh, hello, sir. Yes, we had some of the participants also at our pre-talks. And as always, we hope to get the others to a personal talk on our channel after the Knowledge Festival is over. So for now, we'll not go too deep into the introduction. Just you can find our pre-talks on the channel. You can see the real deep introduction to each and every person. You can go to the knowledgefestival.org website and go through our advisory board, advisory committee, and you have all the information about each and every person there. All of our experts have a very, very long list of achievements in the scientific field. So to get the discussion started, we will go just as some of you might have seen yesterday. It's about a few questions that we will pass through our experts one by one, and we'll see what each of these systems has to say about this issue, about this question. So we will be starting with Dr. Mukesh, and the question is, now, what are the components of the immune system according to Ayurveda?
Thank you. So respected Basil Nasiri, Dr. Vinayak Nair, all the other esteemed experts in this platform. First of all, I would like to thank the organizers for having me in this program. So can I share the slide? I have
Yes,
2 or 3.
Yes, 1 second. I got the wrong person first. So now you are.
Okay. I hope the slides are visible.
Yes.
Yeah.
Very good.
Okay. So I hope that all of you have been brainstorming a lot about all this, right? So
you're coming in prepared. You're with the. Very good.
Actually, the thing is that you might be you might be feeling somewhat bored because I may be repeating a few of the things, because a lot of the things, all the alternate medical systems have something in common regarding the view or that holistic approach towards the health, right? So just now I heard Dr. Senthil's talk regarding the Siddha medicine. So it was a very good eye-opening thing. So we share a lot of things in common, right? So let me speak. I will not take too much time. I will just take about 10 minutes time to share our view regarding what are the components or determinants of an immune response as far as Ayurvedic systems approach is concerned. So what are the determinants of optimal immune response in the Ayurvedic perspective? So as we all know, the basic tenets of Ayurveda, so where Ayurveda says the governing principles of the body physiology include 3 doshas, which are Vata, Pitta, and Kapha. And the body is made up of 7 basic elements in the name of 7 dhatus. They are Rasa, Rakta, Mamsa, Meda, Asti, Majja, and Shukra. And also the 3 main excretory products that are called as malas, which are Sweda, Mutra, and Purisha. So just to give a preamble, that's all. So health as per Ayurveda is considered as a balance or that optimal state of this dosha, Agni, Dhatu, Mala, Atma, and Manas. So if you go through the definition regarding the health, WHO definition of the physical, mental, and social well-being, Ayurveda has gone 2 steps ahead, where it also states that the Atma or the soul also should be in a state of what you call harmony with the body in which that soul resides. So the health is always a balance of the dosha, the dhatu and mala, the manas and atma or the soul, and the mind and the agni, because agni is one of the important deciding factor which keeps the balance. So the metabolism for every living being, metabolism is the what you call lifeline. Without metabolism, we are just like stone or just like any other inanimate substances. So metabolism is the key, and the factors that regulate metabolism are considered under the concept of Agni. So if we look at the immune system, Ayurveda addresses the issue of immunity in the terms of Ojas, Bala, Vyadhi, Kshamatva. There are so many terms that are used to address the functioning of immune system in different contexts. But if you look at the factors that govern, mainly we can consider these factors as intrinsic and extrinsic factors. And in the intrinsic factors, these are the important determinants. One is the bala or the endurance of the body. And again, this can be classified into something that which we are born with, that is sahaja, then something that is decided through the age, that means the kalaja, and the yuktikrita, where the factors like diet, lifestyle, and even therapeutic measure like rasayana, which is very unique to Ayurveda, where we have drugs which are labeled as rasayana. So these three types of bala, that is sahaja, kalaja, and yuktikrita. So in the sahaja, basically it is nothing but the body constitution, or we can say it is the genetic makeup of our body. So the genomic makeup or the genetic makeup of the body is expressed through certain physical as well as psychological attributes, and together or collectively they are considered as prakriti. So if you different individuals are having different prakriti, because the genomic expression, or you can say that it's a phenotype. So the phenotypic expression of that genomic makeup or genetic makeup is considered as the prakriti. So this prakriti itself determines whether you are susceptible to diseases or what type of immune system you will have. Because, for example, it's told that the kapha predominant prakriti, they have a robust immune system which has very chance of developing autoimmunity or other immune disorders. Whereas if you take the example of vata predominant prakriti, then basically those individuals are more what you call predisposed to illnesses. So like that, prakriti itself has some what you call implication on the immune response. Next is the age related. Again, if you go through the modern studies as well, a lot of findings are coming out regarding the relation between age and immune responses. Because if you know, we can see that almost all autoimmune disorders are highly prevalent in the aged, more what you call advanced age group. So like that, age is also a determinant. And another one is the yuktikrita, which are modifiable factors, because the diet, the lifestyle, and even the therapeutic interventions like rasayana can determine the immune response. Next is the dosha status. That means, as I told earlier, the balance of the three doshas in the body are inevitable for health. So whenever there is any disturbance in the dosha balance, that also can lead, or that also can lead to weakness in the immune system, leading to diseases. And next is the dhatu status. That means I have already told that there are 7 dhadus. And whenever the dhadus are there in their excellent state, then the body will be more resistant. So the overall essence of the dhatu is considered as ojas in Ayurveda. And there are so many drugs that are considered as aujasya. That means that which promotes ojas in the body. For example, if you take the example of COVID-19 now, we are giving a lot of medicines that has action on the ojas. Example is Withania somnifera or ashwagandha, or tinosporia, that is guduji. So there are a lot of drugs that is acting at the level of ojas, which can again promote or modulate immune system. And next is the one of the important one. Even Dr. Senthil in his talk discussed about the importance of gut microbiome. So the Agni is nothing but the principles that govern digestion and metabolism in our body. So anything that is related with the enzymatic activity or the motility factors or even the absorption, all these things will come under the concept of Agni. And recent studies have, even in the recent studies of the modern medicine, have highlighted the importance of the gut and the relation with the immune system. So we know the what you call as the gut microbiome and the immune axis. So a healthy gut will always give you a better immune response. So this is the importance of the concept of Agni. And another important factor is the Sattva Bala, or the mental strength. If you have seen in practice, we can see that, let us take an example of common cold itself, apart from COVID-19. Just the common cold virus. We in practice, we see that a lot of patients, whenever they are under stress, they are more prone to get this, catch this cold, right? So like that, even the mind has that. So there is a new field of psychoneuroimmunology where the relation between the mind and immune mechanism is studied in a extensive way. So all these are the intrinsic factors that determines how the immune system of your body responds to different stimuli. And the extrinsic factors, again, desha, that means the habitat, the region from which the person takes birth or he is living at present, this is again having a very high influence. If you go through studies, there are a lot of studies that says that the habitat is very important in determining the immune response. And the other important one is the kala or the season. So seasonal variations have its own implications on the immune mechanism. So see, these are some of the determinants of immune mechanism as per Ayurveda. Just so collectively, these are represented as the term pratyaniga. That means that which opposes the manifestation of a disease. So these are the determinants. Just before concluding, I would like to highlight another point. So if you go through the modern models of immune regulatory network, previously they used to follow this what you call a simple model where one factor triggers the other factor, or one cell triggers the other cell, and that cell triggers or stimulates the other cell. So this is a linear model. But now modern medicine also has come into what you call, they realized that this linear model does not work anymore. So the new model says that it's a network. That means a lot of cells or what you call mediators and signaling and channelings. So a lot of this, there is an interplay of all these factors. So it's a big network. So always we should go with the systems approach rather than a reductionistic view. So if you go through Ayurveda, then all these factors, they have a very big interplay between them in deciding in which instance how your immune response will be. So at one instance, all those factors will be in an optimal way so that the body is resistant to diseases. But some one or other factors, they start getting affected, then this network again gets affected so that the body is susceptible to diseases. So we should have this holistic concept rather than a reductionistic view, even when we deal with an immune response. So we now see that even in COVID-19, we can see that even vaccinated individuals, they are getting diseases. And now even death have been reported in individuals who have got both vaccines, right? So there are something missing in that what you call analysis, so that there is some missing key that we have to find out. So how we can find out? We should go with this holistic approach. So when we did a simple analysis here in cortical, where we observe patients, what we have seen is that people with good dietary habits and good lifestyle, they cope up with these infections in a better way, rather than people who doesn't have a proper diet and lifestyle. So one simple factor of diet and lifestyle itself has that much significance on the immune response. So once again, I thank for the time that is provided to me. So that is the Ayurvedic view, so that it's always multifactorial. There are a lot of determinants that when they collectively they act, then we have a better immune response. Thank you for your patient listening.
Thank you very much for this very visible way to go through that. So just to get that clear, all these factors have some sort of interplay, and this will be different from individual to individual. So, I mean, how would you? I mean, I don't want you to go too deep, but would you say some of these components are have more weight, or some of them are more important, or would you say it's depending on person and organism and all that?
Yeah, actually, if you ask me, some of them, if I have to point out which one is important, then it will be difficult. But still, I would say that the prakriti or the genetic makeup is the most important one, because that even decides the metabolic activity as well. So if we say that there are different forms of Agni, but this Agni can be influenced by diet, even the seasons or other factors. But still, you will have a basic what you call type of Agni that is decided by the genetic makeup. So that is the first thing. So there are a lot of studies now going on where when in pregnancy itself we give medicines so that we bring about a better progeny with a better all these determinants, right? So there are even studies and works going on in that direction as well. So prakriti is one of the important factor. And after prakriti, if you ask me, then it should be diet and lifestyle, because that is a key that which we have in our hand. So where with which we can modify that. At least we can assess all these determinants. We can have a basic profile of every individual. And if you assess every individual and you look at the profile and you see in this given individual which factor is more deficient, then you can address that. So in such a scenario, I think diet and lifestyle is the most important thing that we can have.
All right. So, but still, you kind of, you gave it all to the genetics also. All the doctors are giving us, giving us this harsh truths about all kind of stuff in your life is predetermined by some things. I mean, obviously we can do something about it, but we should understand that certain things. I mean, this is also what the modern medicine is telling us, right? About the whole genetic setup. But maybe it's also important to know your setup to move on from there. So therefore, we should understand this is the huge role of your predetermination, and you have to take that into consideration to have the best life for yourself that is possible. So thank you for that first view into the Ayurvedic mode. I will go on to Dr. Senthil from the Siddha community, and would you please give us a look into these components of the immune system according to the Siddha medicine?
Yeah. Hello.
Hello. Yes, we hear you.
Yeah. Now, as it's already discussed about, we normally the gut. We usually say that gut is the only thing which plays a major role in treating the disease. When it is Vata type, Vadam, we used to say Vadam, Pittam, Kabam. If it increased, we give Brechana type, so that it will get out all the amas from the stomach and the intestine. So we treat in that way. So I like to add the same. Gut healthiness is the only way to get out of all this behavioral and cognitive disorders, as well as the mental illness, everything.
So how would you, in the Siddha view of things, how would you see the genetic predetermination?
Yeah, genetic predetermination, we go with the constitution basis. Like we have the constitutional basis. We have the 9 basic constitutional classification, Vata, Pitta, Pitta, Kapha, like that. We don't, as per the literature evidence, people used to say diabetes is a genetical factor, but now we can end up in saying like it is more to be a lifestyle disease, not the genetic factor, which only the genetic factor which triggers the diabetes. If it all, if the dominant, if the non-dormant gene is there in the particular individual, if the lifestyle is so poor in that particular individual, will keep triggering that dormant gene to get into a diabetes. If at all he is not having such good lifestyle, he ultimately end up in getting the diabetes. So that's what we see in genetics. So genetically carrying disease are little bit having different views in Siddhas. Not all, because in past 20 years, diabetes and psoriasis and other thing, they clearly say only because of it conducts through only gene. But now when we see in current scenario, we see lot of diabetic patients in our clinics. but they don't fall in a category of any genetic predisposure or something like that, only because of their lifestyles, which is existing between the age of 25 to 40. Because of the poor lifestyle, as I say, like junk foods without any proper mastication, without the food has been not properly chewed and mixed with the saliva, which has to be absorbed in the mouth itself. It passes through the stomach, and that poor enzymes will not allow to digest that material which has to be already digested in the mouth. So such type of lifestyle, people are now unaware and keep on adding to one another, and untimed food and late night food. During that time, pitta will be so less, and we get more mucoid toxin in the intestine. Accumulation of this type of mucoid toxin adding day by day, at one time it will progress as a metabolic disease. Either it will end up in a diabetes, or either it will end up in an autoimmune disease. So people who started having that poor lifestyle and the diet habit in 20s or 25 years of old, they ultimately end up in RA, rheumatoid arthritis, or autoimmune disease, or such kind of metabolic disease. They end up by 40 itself. So it doesn't, since we can prove that genetic predisposition is there, but in current scenario, I suggest lifestyle, which is the predominant factor. Food habit is the predominant factor, which is sitting in the top of all the causes to get diseases, and ultimately it ends up in gut hygiene. So we see a lot of cases in that way of in our clinic.
Okay, very good. Thank you very much. We move on to Professor Aleemuddin from the Unani community. Very great to have you on. Thank you for coming. Please, sir, would you give us your idea of the components of the immune system?
So before, good afternoon to all of you. It is with reference to Indian continent. This is almost 3 o'clock, so it is my accustomed to say the adab to all of you. And moreover, to bring my concepts more clear, you please permit me to share, of course, the presentation.
Absolutely.
In
Yes.
a draft mode.
Just let me give you all the rights. There you go.
Please. Yeah. Though this is still in a draft mode only, but I would like to share my opinion with all of you people in a given stipulated time only. Is it the slides are visible?
Yes. Perfect.
Yeah, thank you. As the session is going on about the components of immune system, this is though it is a very latest term. In fact, in the medical field, hardly we came to know since 1960 only. Before that, it was not, though the existence of the immune system and immunity was not there. It has been described in different paraphrases. Like science says, I'm just going to speak about, with reference to Unani medicine, what is this immune system and immunity. The outlook is understanding immunity first, little bit about the historical evaluation of the term, evolution of the term, sorry, here is evolution of the term immunity, followed by little bit about understanding Unani system of medicine, little fundamentals where I'm just going to cover the components of the immunity and the concept of immunity in Unani system, followed by let us try to understand the temporal perspective along with the Unani perspective of this immunity. Finally, conclusion, most of the things it is draft only, but keeping the opinions of my previous speakers, my predecessors, I'm just going to add some of the things. Thank you for giving the opportunity. We know that understanding the immunity, basically this is a biological defense mechanism which is fighting against the disease and all those infection. That we call it as immunity. This is very latest term, in fact. Rather, we can say this ability of the body to resist or fight off infection and the diseases. And his document says that the term immunity is derived from the phrase Latin, which is from immunitas. Basically, this term was used for the commercial purpose in this Latin phrase, which stands for the exemption from the tax. Mean, if a person paying tax for one particular commodity, he will be exempted to not to pay the tax for some other thing. The same thing has been used in the medical purpose. Like if a person infected, then the person may not be likely to be infected with the reinfected from the particular disease. That was the probably the reason they have given the term immunitas. And there is immunity types also there: innate immunity, inborn, acquired immunity, and there we have little components like the humoral, antibody mediated immunity, cell mediated, active immunity, passive immunity. Altogether, there is a complete system, immune system, which is regulating in preventing the infection and the disease. What it is with reference to the modern perspective. Little bit to understand about the historical evolution. What I thought, in fact, the medical document says that the first time the concept of immunity was supposed to be observed during the plague of the Athens in 430 BC, reported by the medical historian and the Thucydides. He said that the concept, he is the one who gave the concept of the natural active immunity. In fact, the medical literature says that Udia, that nothing but this is the ancient in Indian peninsula, the northeastern India, today's Odisha. That is very adjacent to the, it is a connecting link between the southern part of India to the West Bengal state is there, and it's a time immemorial. People, they used to practice that inoculation and the variolation. Why I'm giving this point is just try to understand the concept of when we have got this immunity and how this immunity system has came into existence. And the document says the history, what I have understood is around more than 3,000 years back, it was the state Odia, that is in Odisha, India. The people started practicing inoculation and the process of variolation to prevent certain infected diseases there. And the historian says this practice is being transferred from Odia, the so-called northeastern India, to China, Africa, Turkey, Europe, and finally it reaches to America somewhere in the mid of the 18th century. That is the reason Edward Jenner was supposed to be called as the first person who speak about immunity and 1798, and he reported that the people could be protected from smallpox with the variolation that was supposed to be called as the immunization. And further adding some more information here, Louis Pasteur is the one who speculated about the immunization protects against disease, and that leads to understanding the immune system, learn to fight against it. Further components of the modern understanding of the immunity was imbibed by Paul Ehrlich, who gave the concept of the humoral immunity, and Eli Machenkov, cellular immunity. Louis Pasteur, Robert Koch, all these people told about that there are certain organisms, what we call the seminaria, small seeds are there. They are responsible for the cause of the infection. If a person infected, they may not likely to be get reinfected with that particular diseases. So all these keeping the background, some of the things which has made a revival in the medicine where Paracelsus and Proctor-Sorius has told about the epidemiology, and he is the one who explained about the theory of contagion. Before that, the Unani people contribution also would like to place before you. And coming to my part of the discussion, understanding Unani system of medicine, this is a WHO recognized system of medicine as a traditional or complementary alternative medicine. And in India, this is a part of the integral system of medicine of the Ayush, where A stands for Ayurveda, Yoga, Unani, Siddha, Swa, Rigpa, and Homeopathy. And very interesting thing is that today's conventional medicine, so-called allopathic medicine, they believe that the father of medicine is the Hippocrates. And now it is very fortunate. The science which is laid based upon the theories, foundation of the Hippocrates, to whom we consider them as the father of medicine somewhere in the 5th BC. He is the one who conceptualized the theories of the medical science. From there, with the length of the time, there are so many metamorphosis changes has happened. And today, I think some of the conventional medicine are with the minor differences in the philosophies, understanding, and the practices. Different sciences have been arranged as a medical practices. So father of medicine is the Hippocrates. Later, basically the people from the Greece, Roman, Arab, and Indian physicians, they contributed this medical science. Among them, I can say Galen is from Roman. Roman physician. Razi, Ibn Sina, Zohravis are the Persian physician. If you come into the Indian continent, we had a very good people like Akbar Arzani, Hakim Ajmal Khan, Hakim Azam Khan. They are the people contributed to understand this science, has made this Unani medical system as a complete science. This is of the brief introduction. Coming to the fundamentals, in fact, the components of the immunities are under the part of the fundamentals. I would like to throw some light upon this. In our theories, the fundamentals, we have a umur tabaya. There are certain natural factors are there. under which we have 7 important components of this. That's called as the arkan. If you try to understand this arkan with reference to the Latin in the modern conventional language, these are nothing but the primordial substances are the elements to whom we called as arkan. Like our brothers from Ayurvedic systems medicine, they speak about this Mahabhutas are there. Similarly, I think so. In Unani, we call it as an arkan, where we have Ag, Hava, Pani, Mitti. If you look at that, the globally, entire globe is globally, we are living on the planet Earth. That is the base upon which we have a water, above that we have a air, and above all we have an, that's what is the fire. All these called as the arkan. They are the very, and all these arkans have a very potential quality, and that qualities are considered to be as a mizaj, that the same other science people like Ayurveda people say about the prakriti. The prakriti, something before the prakriti, we have the constitution of the individual that has been termed as whether it is a bhar, mizaj, barit, ratabanya based upon the quality. Akhlat are the very major components, like the Tridosha of Ayurveda people and some other Siddha people also speaking, the Tibetan medicine people also speaking more or less the same thing. Akhlat, they are the body fluids based upon the color. They have been categorized into 4. Unani system of medicine is the one which speaks about there are 4 body fluids, like Paracelsus theory of the elements and other few more people of the Greek and Roman physician. They said that there is a body fluid that what is called there's the equilibrium of this body fluids leads to health. Any condition which causes that disequilibrium among the 4 body fluids can leads to ill health or the disease. Here under this part, Akhlat, we have blood, phlegm, yellow bile, and black bile. And few more things are that the body contains organs, different simple organs and the compound organs. There are certain faculties, and there is a spirit and functions also there. If you look into this, my science says that there is a balance of all the things should be there, like the elemental balance and the constitutional balance and the fluid balance, the akhlat, the 4 humors. If all these things are in appropriate ratio, if they maintain equilibrium, then only the individual's health will be retained. Any imbalance, disequilibrium leads to there is a derangement in the condition, and that causes diseases. Adding to this, we have another concept called as the Asbab Sitta Daruriya. Basically, it is an Arabic term which stands for the 6 primordial substances called essential factors, which are there with the human being throughout the life. As long as the human being is survived, without this, nobody can survive. Here, we need to have certain modulation. Like no individual can be survived without the ambient air, the air which should be pure, qualitatively based upon the individual's prakriti or mizaj and their elemental constitution. And there is a balance of the foods and the drinks, physical movement and the rest, psychic movement and the rest, sleep and wakefulness should be appropriate. Retention and evacuation should be taken place appropriately. What we are taking and how much of the substance should be eliminated from the body has to be made all these things equilibrium. Anything goes abnormal here, and it is the essentiality of the individual to keep maintaining the modulation of all these 6 essential substances that can keep the person healthy. So these Asbab Sitta Zururiyas are the one which modulates individual health therapeutically as well as the prophylactically. Above all, these are the one which is going to help out about the nature and the quality of the immunity also. And adding to something, in Unani, we have 3 moderate, that the treatment modalities are there. Ilaj bil dawa stand for the drug therapy, where we use single drugs, preferably upon that the patient not responding to, we'll add compound drugs. And 90% of the drugs are from the herbal source only, and a few animal and mineral source also there. Ilaj bil tadbir is something like a regimental therapy, where we have 100 number of regimens are there based upon the requirement of the individual. These regimens can be used as a prophylactic as well as a therapeutics also. Prophylaxis means where we are going to strengthen the immunity and the vitality of the individual, where an major portion is dietetics, the principles of dietetics also being part of that one. Ilaj bil Ed is something like a manipulative techniques are the surgeries. Finally, the principle what we follow in our system of medicine is every individual is having its own temperament, that is mizaj. And even the monozygotic and the dizygotic twins are also sharing the similar kind of a temperament, but there is a minor difference is there, because no 2 individuals are alike. Genetically, they are having the similar makeup, but there is a mild difference is there. And every disease is having certain misage affliction. Like my brother, Dr. Mukesh was talking about that there are certain diseases which are cold in origin. Like if you take in a common cold, according to our understand, it is purely a cold in temperament. Barid misaj ka marz hai. So the disease should be treated with the contradiction, what was heterogeneous kind of a property. Usul bizid mean contrary to the disease condition, where we use only the drugs, diets, and regimens which are of opposite in nature. This is about the fundamentals. If you look at the components of the immune system of the Unani medicine, I would like to say, when the modern medicine says that in the modern medicine, the structure of the immune system they have explained about, there is a lymphoid organs are there, where primary, central, that is the bone marrow, thymus, secondary, peripheral, where we have lymph nodes, spleen, and mucosa associated lymphoid. Lymphoid cells, again, we have the T lymphocytes, B lymphocytes, natural killer cells are there. There are other cells of the immune system where we call it as a phagocyte, macrophages and microphages, dendritic cell, mast cell, platelets, etc. And above all, there are such cytokines like interleukins, interferon, tumor necrosis factor, colony stimulating factors. This is the what kind of the modern understanding. And now my science says that if you look at that umure tabayya, the physiological factors, arkan elements are there. All the elements have a different qualities. As long as these elements are maintaining the qualities, and that leads to a restoration of the health, maintenance of the health, free from the disease. Followed by every individual has its temperament, and the body fluid is also there. Equilibrium of the all the body fluid should be appropriate, and that leads to health. If you come to the part of the organs, like the modern conventional medicine people are elaborately describing about the components of the immune system, like a spleen is an organ, thymus is gland is one, bone marrow is the source of the immune substances. Like in Unani, we have organs are there, where we have two different categories of organs, like a single organ and the compound organs. Compound organs are something like the vital organs, like the head, brain, heart, brain, and liver is there. If you look cleanly into the Mufarad organs, ism stand for the bone, and basically bone marrow is the one of the source of immune cells. And like Ghazroof, Rabat, Battar, Ghisha, Asa, and the highlighted point, Shaham is something like a fat, the muscle, and Laham is something like a fat. Mukh is a stand for the bone marrow. Somewhere, Unani physicians, they have, of course, their insight was very something appreciable, though they don't have the resources to deeply try to understand the cellular or the humoral components of the immunity, but they have paid much importance about these organs. Today, we are accepting that these organs are the source of the components of the immunity. Like every organ, the functions are there also things. Coming to the major point in Unani, that immunity, as if it is as a very latest, 1960 only it came into an existence. Before that, Unani people, that some of the authorities like Razi, Ibn Sina, they are the one who give the concept of the germ theory, and they are the one who speak about the contagious and this infectious diseases. And properly, they are the primary people who give the knowledge of what is called the smallpox and the measles. And they have given all the quarantine measures, how to prevent this, all these things. I can say Unani system of medicine, the physicians, they are the people connecting link between the classical concept of the paraphrases towards undefined terms of immunology, immunity, with the modern conventional science where we are today understanding about the concept of immunity. They have paid attention about the immunity, the role. Our Atibba, our physician, told the immunity is supposed to be considered them as the tabiyat. Tabiyat, because it is something like a multi-dynamic function. It carries different kind of functions. It prevents, it prophylaxis, it strengthens, it go for reproductive functions. All major functions it will carry, subject to the other conditions of the individual should be in a balance. And for your references, I'm just giving this tabiyat. And in the classical physiology, there is a term called as physis. So it's a Greek term probably that stands for medicatrix nature. And Unani believe that there is a fitra, there is a nature that we call as a tabiyat, which will take care of the individual. All these are very classical terms. Today we are calling them as the immunity structure. As I told you, conclusion is something that infectious diseases are known to the human beings since antiquity, but man can learn things from the nature, because our science, nature is the best physician, and they are just to try to keep the people all their energies, all their immunity very strengthened by means of giving certain diets, drugs, and certain physical exercises also. And most of you have covered that in the history. It is there. Nature helps the sufferer in the form of something like emesis, purgation, diaphoresis, diuresis, etc. And we take care of all the patients. Suppose if they are suffering with different diseases, we suggested them as a preliminary treatment. Sometimes we induces emesis, purgation, diaphoresis, and diuresis also. And we have a number of drugs and dietetics, certain regimens where we consider them as the immunomodulators. Means sometimes based upon the individual's condition, sometimes they cause as a stimulant, they sometimes it may regulate the immunity. Like all Dr. Mukesh was speaking something about some conditions. Yes, of course, we have a list of the diseases. Today, what we are understanding as the something like autoimmune conditions like psoriasis. As a practitioner, physician, though my science says psoriasis is just because of when the melanolic substance accumulation. That is there that causes, of course, a complete pathological sequence has been explained. As a physician, I started treating the patient with the cognitive medications of this melanolic, where Tribunella tubula and some of this, what is called as the Palanthus neruri kind of drugs are there. It is being mentioned in the literature as the best melanocolic, best choleric drugs. Starting with this treatment, adding some of the lubricants and this moisturizing emollients, we have got a very wonderful result. If the modern science says this is a purely immunology, autoimmune problem, of course, keeping the endurance of the individual, giving certain immunomodulated drugs like we have a compound preparation like a Khamira Marwarid, and some other drugs like the principles of the Unani medicine like a Conction and Conation, we are doing very wonderful job. And we believe that today's immunity subconsciously in the past, since the beginning of the Unani system of medicine, we are considering it as a tabiyat, as a different paraphrase. It was there, and Unani people are supposed to be they are one who give contribution in the field of immunology, because Razi's smallpox and measles concept, and he is the one who explained about the variolation, vaccination, inoculation procedure, and Ibn Sina's contribution to management. Some of the diseases like infectious diseases, tuberculosis, diphtheria, cholera, and all those things says we had a very wonderful past, and today we are practicing with the same concept. This is about the components and management of autoimmune diseases and the immunity-related issue from Unani system of medicine. Thank you. I think I have taken much of your time. It is over to the organizers, please.
No, thank you very much. That was great. We also had fewer people telling us more about Unani. So now we are happy to hear even more. So that's no issue. We're gonna come back for the next round when the next question, because it will be a three-part question that we go through about the components, and then we'll be through with this discussion round. But for now, thank you, and we go over to Dr. Subramania from the yoga section. So, Doctor, would you give us a short overview over the components of the immune system according to yoga and yoga therapy?
Thank you, sir. Respected speakers and the organizers of this webinar, Nesari ji and Radhakrishnan ji, Vinayak Nair Radhakrishnan ji, and yoga per se is an ancient wisdom and originated 5,000 years old science for experiencing, that is for evolving or to reach the higher states of consciousness. In the recent past, yoga has been utilized for therapeutical applications. So, yoga includes the breathing practices, regulated breathing practices called pranayama, then asanas, different sets of asanas. Then most important is Shat kriyas, cleansing practices. As the speakers, Siddha, Ayurveda, and all homeopathy also will be discussed later. The concept, more or less, the concept is same. We have to remove the toxins from the body. Then there will be promotion of health, positive health will start increasing. So whatever recent, now whatever we have discussed, more or less the concept is same in yoga. So removal of toxins from the body can be through different methods. We have Shat kriyas, in that majorly Vamana Dauti, that is drinking salt or saline water and cleansing the abdomen, this digestive system, so that whatever the Ayurveda Siddha speakers have spoken, that is increase of the gastric fire, increases the hunger or appetite. Hence, elimination will be proper, digestion will be proper, health will be promoted. Promotion of health will take place. In this concept, along with the modern medicine and other systems of medicine, yoga playing a major role for as an add-on therapy without any side effects or without any complications. Hence, the people who are suffering with diabetes, hypertension, or any, even cancer, any type of diseases can be well managed through the therapeutical benefits or applications of yoga. So this is the concept, the ancient Indian science originated in India, yoga, and it is well practiced, accepted throughout the world. And June 21st, we are celebrating the International Day of Yoga throughout the world. And this is a accepted add-on therapy for major types of or all types of disorders, psychosomatic ailments, and now the people are started with the awareness, they have started to practice and get the utmost benefit of yoga. So I mean to say, the daily practice of yoga has proved or improving a health concept in all the people in the sense, people of different ages, children's, adolescent, and the old age people, women's health, etc. So all people are getting the benefits of yoga and moving towards the positive health. So this is my view.
Very good. We will come back
Thank
to.
you,
thank you for the first. So mostly yoga also goes together with Ayurveda and Siddha medicine and possibly also in the roots with Unani medicine, and in the end very much basically to the modern medicine also, but we see a few different approaches. I just want to go to a final round with Dr. Abhishek Devikar.
I think doctor is not here.
He's not here? All right, fine. Then we'll go to the second question, which is a second part of it. I mean, Dr. Subramania just took away one step, which we will still get to with the other systems. So how we can really treat all these imbalances, diseases, whatever they might be. But one important question is, what are the signs that something is missing, that some of these components are not working or are not there at the place they should be and at the level they should be? So the bodily or mental or psychological effects that will show me that something is not working properly, and I would like to go through all the systems so everyone can say from just as we did up to now. So we go back to Dr. Mukesh, and please tell us what would be the signs that something is missing, that these components are not in balance.
Okay, so the question was, I think Dr. Vinayak has posted the question in the chat box as well, I think, right? Yeah. So see, as Ayurvedic doctors, or if you ask any of the experts here, whenever we analyze any patient or an individual, we always look into subtle factors rather than gross symptomatology as such. I will narrate this through a very simple example. Suppose a patient came to us with a low back pain. You take two scenarios where this patient with a low back pain is going to a orthopedician, a modern orthopedician, and the same patient is going to a physician who is practicing any of these alternate systems. That means Siddha, Unani, Ayurveda. The difference is that we, apart from taking the proper history about the low backache, we will be asking a barrage of questions to the patient regarding the diet, the lifestyle, whether he has good appetite or not, whether his bowels are normal, how is his urine, what is the color, is there any smell for that. Even we ask them about their dreams as well. So the patient sometimes will be very much what you call dumbfounded. Why these fellow? I only have a back pain, and why are these people asking me about my dreams and all? What is there to do with that? But the thing is that the gut, when it is imbalanced, it will give you a lot of subtle signs, which as an individual themselves will not be able to identify. So we usually, what we have found is that out of 100 individuals that we see in the society, at least some 80% of them have some or other dysfunctions in the gut. But the problem is that they are not able to identify, because that defect has not reached into a threshold where it will express itself as a disease. So the body has immense potential with regards to its what you call where it can compensate a lot of things. So when this mechanisms that compensate fails and that the pathology goes beyond a threshold, then the patient will present to you with symptoms. So when the gut is affected, usually what we get is that the patient, the individuals will say that their bowel habits are altered. Usually they say that on one day I will pass the stools 1 or 2 times, in other day it is 4 times, like that. So there will be some alteration in the bowel habit, or there will be some alteration in the consistency of the stool if you take a long-term history. Then there will be subtle signs like mild burning, or even some patients will say that I feel tired immediately after taking food intake. So that feeling of tired immediately after taking food itself indicates that your Agni is getting weak. But it's not ruled that it is going into a diseased state at that stage. But if you don't identify that at that correct time, then this patient is, or this individual is bound to go into some or other diseases. Some individuals, they say that whenever I wake up from the sleep, I feel I'm not refreshed at all. I don't feel that I have slept well. So like that will be there. And even some individuals, they have some psychological manifestations in the form of depression, anxiety, etc. So this mind and gut is a bidirectional thing. So something that affects the mind, then it can affect the digestion. And exactly the opposite also happens in practice, where we have seen a lot of patients where when we improve the gut health, their depression and anxiety goes off. So only thing is that we should be able to identify which one came first. So for that, we need an elaborate history. So in the first case scenario, the patient may be having normal diet and lifestyle, but some stressor event was there for the mind. In the another scenario, the patient, the individual will be having an erratic lifestyle, irregular timings of food intake. So a lot of things will be there. So we'll be able to identify, at least in some 70% of the individuals will be able to identify which one came first. But when we correct the gut, then all these things will go off. So there will be subtle signs, and as a practitioner, you have to spend too much time. But nowadays in the new era, we have all these eye patients, so that the patient will come, the doctor will be looking at the computer screen, he will hear the symptoms and he will enter some investigations into the computer screen. And after half an hour or 1 hour or 2 hours, the patient comes back to you. And again, the physician is not looking at the patient, but the physician is looking at the screen regarding the result. And the prescription, again, it's generated on the screen. The physician is not at all looking at the patient, right? Even there will be some subtle changes in the skin as well, like dry skin, a lot of things. Some patients will tell you that I have hair fall, and you go through all the modern investigations, everything will be normal. But this hair fall will be an indication not proper. I mean, how many physicians look at the tongue properly now? Just like they just say tongue is coated or not. That's not the only thing that we have to look at the tongue. So there are a lot of things that we can look into and identify. So, but all these things are very subtle factors. So you have to spend enough time with the patient to identify. But obviously, the signs and symptoms will be there for you if you are ready to investigate in a proper way.
Right. Thank you. So even as a normal person, so to say, you can have some idea of your own digestion. You can have some idea of your own well-being. Still, I have to say, in the Ayurveda Center here, we have had people who, I mean, I don't know, it seems to be more a normal thing in Europe. People who have really non-working digestion systems, who have been having issues for years, who basically think it's normal to have certain things, you know, some burning acidic systems, some not working digestion for days. I mean, it's, you were talking about going from 2 hours to 4 hours. I have talked to people who have been through phases of 2-3 years of not some kind of routinely regular functioning of the body. So I think in those cases, people can make some assumptions on their health and maybe do something about it. But as you gave us a few things that probably everybody can observe for themselves, and some things that like I mean, like the smell of the breath, or maybe the color of the tongue, or maybe whatever that somebody outside can see better or judge better. But you gave us a few of those. Maybe we go on to Dr. Senthil, and he can tell us, because he brought up the gut, the importance of the gut, and maybe you can tell us something specific outside of what we already heard. Maybe we already heard everything, but is there something specific that from your point of view you would go for and say this, you know, this kind of situation in the body points to issues with the gut?
Yeah, as rightly said by the Dr. Mukesh, and like what my guru, like when we took this same question to my guru, he used to treat all the regions of the people who from all the region from the country or world. Like if I say to a patient, currently if a patient is coming, we can classify into two categories. One, physician identifying symptom in a patient. And one thing, patient self-realization, like whether I am normal or not, that part is very critical. If you ask for a whether you are passing motion, if you ask a patient whether you pass motion regularly, they simply say, I pass motion. They doesn't bother, because we keep on insisting, asking how much time you spend, what is the quantity, and what is the nature of the motion and such thing. When we put across the question in deep inter, then they will keep on revealing. After I usually read the nadi of the patient, and I can get easily, when the vada is struck, I easily ask you, do you have constipation? Mostly people, if they are already existing with the constipation, they will reveal. But some of the patients said, no, I am passing the motions very freely, like. But when I ask what type of toilet you are using it, ultimately in India, 80 to 90% in the urban area, they use Western type. I strongly challenge people who use Western toilet doesn't have a proper bowel system, because that anatomy itself doesn't allow to evacuate all the fecal content in the large intestine. So that itself being harm to the intestine, that is the one main reason to get easily vada predominant diseases. So such thing, if I come across, first I will say to ask to evacuate free bowel system. Second, we in Siddha system, we clearly insist to take oil bath. Oil bath, which categorize, we categorize Sukutailam like ginger, dried ginger mixed oil for vada predominant individuals. And for a Kaba dosha, Kaba predominant dosha predominant individual, we used to advise for Nirgundi Thailams for oil bath. Once we get cleared out of all this intestinal thing, we advise to go for an oil bath every week. So that makes them in a year, in a week-long period, they used to work for like an engine. So they usually have a pitta predominant, and it will go and locate in some other region pitta. So to reorganize all this tridosha into their own space, we advise to take oil bath every weekly once or weekly twice. So that this two advice, the patient can do it on their own. This is the two to get the bowel clean, either by taking, if you have a constipation, simple castor oil will help you to get the bowel clean and have good gut bacteria in your stomach. So we do with the help of Varma. Varma is one which stimulates the energy sources within the body to channelize the energy flow into the body, so that all this Vata Pitta Kapha will settle in their own places, and it will lead a healthy life. So these two things, keeping the gut free and taking oil bath regularly, will keep the individual in a healthy form. But at the same time, when it is a disease condition, it's a different scenario. We deal with step by step, depends upon how the patient responds to us. These two factors, I think. And the other question which has been asked is how we can neglect pesticide contaminated food and those things. If in India, especially in South India, if the patient comes and asks me, I'm a diabetic, why can't I take neglecting rice? Why should I take wheat, whether it controls my sugar? I said that doesn't work for you, because we believe in environmental science and environmental factor much more, because we categorize the season as 6. So depends upon the seasonal variation, we need to change the food pattern so that it will adapt to the environment and protect us from this all Panchabhutas, which triggers something in our body, physical variations in our body. So if I strongly advise my patients to take their own locality foods, If you're living in an area where you get millets, where you get rice, please take that. Don't go for a wheat which is produced in somewhere in North India or somewhere in Europe. So try to eat whatever, whether it is fertilized, or that is pesticided or something else, whatever it is. Go with the food which is cultivated natively. Don't go sitting in India and taking olive oil is not advisable. Sitting in India and taking oats is not advisable. Sitting in India, which take native foods, which keep you close to your environment, and you don't get that much of disease when you take the food which has been bought up somewhere else. So this culture need to be adapted. You need to take the native foods. Then you, if possible, you can cultivate in your own ground. You go with the organic farming and get cultivated for small vegetables and such thing. You can cultivate on your home itself. So this thing I can conclude with that. So native foods which has been cultivated natively is very good, because I see, because patients give feedbacks to me when they started taking native foods, their eyesights and their hair falls and their that graying of hair and such cosmetic related thing itself getting fulfilled. So they are happy with taking of native medicines, native foods. So this three things, like cleaning the gut and taking oil bath and taking the native food without appetite, without get appetite, if you take food that is harm to the stomach. If you are not getting appetite, don't take food. Put your stomach empty. If you get appetite, go for your chance. Otherwise, stop putting unnecessary loading of stomach will ultimately end up in forming ama. That definitely will lead to all the metabolic type of diseases at this scenario, because I am a practicing in this scenario. So I should speak about the current scenario of the people which I am facing it. Thank you.
Very good, thank you. So basically, we now have a few things to look at to find out how well our body is working. Then we heard some measurements, some ways to help the body clean up and get healthier. And we heard not only oil bath, but also you should kind of maybe update your Western toilets, because just saying on a side note, there are kind of the things for your feet to put up for the Western toilets if you want to kind of simulate the effect of the old age toilet, where your knees are higher up, which would push on your bowel. So just on a side note, there are ways to kind of adapt. And also you gave us the oil bath. I would recommend everybody to also go through our pre-talks where some of these concepts are talked about in a deeper way. And also what we heard is, of course, I mean, this is a political kind of issue to go through. We cannot make the agriculture, turn in weeks, months, or even possibly in a few years. But that's also on our list. As we talked about yesterday, Open Attempt has agriculture as one of the four staples, as 4 departments to work on towards a better life. Still, Dr. Senthil just told us it's probably healthier to have a normally grown vegetable or food from your region than going for some probably even very well done and organic food coming from far away. So if you're in Europe, maybe buying some organic vegetables from South America is not so much better than just eating the regional stuff that is not done in the organic way. Also, there are financial hurdles that you might have to jump over. So if you don't have the money, you cannot buy the fancy stuff. You cannot buy all organic. That's understandable. You still can make it regional. You still can go for more, vegetables and fruits. And as Dr. Senthil just said, you can just eat less. That's always a possibility to just leave it empty. It doesn't hurt. If it hurts, just eat something, please. But usually it's not bad to keep it empty for a while. Now let's go on and see what the Unani section has for us to see whenever something is not working in the body, whenever the immune system is in a bad shape.
Coming to the fundamentals, what I have told, there are 7 principles are there about, but the 6 essential prerequisites are there. First one is that air should be clear as per your body requirement to keep healthy. It has to be modulated. The second thing is the food and the drinks what we are taking, where we have to pay attention about the 2 things like quantitative consideration and the qualitative consideration. Here my science says that every individual is having his own particular temperament, that mizaj, prakriti. Accordingly, the diet should be prescribed to them. So for example, if my temperament is of the phlegmatic one, I'm going on consuming the diet which are of cold in temperament. Ultimately, it is going to disequilibrium my body fluids and other components. So I must take the diets according to my temperament. That's contradictory, but it is not something like that I have to take a huge high, what is called as the hot quantity of a quality of a diet. So modulation is required based upon the circumstances. Diet, what is called as the food and drink. Second, third thing is there must be balance of the physical movement and the rest. If you're not doing proper, today the major problem with the people is lifestyle modification, where people are adopted to such a what is called as sedentary life kind of things are there. There's a major risk factor. There is one of the major reason for that the people are developing so many non-communicable kind of diseases. If somebody says that you are looking like an obese, maybe the nature of what you are doing, you are not adequately spending physical movement that is required for your body. So modulation in the physical movement and rest is also important to keep a person healthy. And the fourth component in our science says that there is a modulation in what is called as the maintaining the balance of the psychic movement and the responses also. The rest is also important. We are not the philosophers. Generally, the people are like the previously he was telling about that people nowadays, they are more anxious and that anxiety levels are high. Stress is there. And if they are unable to control, probably they are likely to fall into the disease of anxiety related issue. And sometimes they are going to be depression. The reason is they are unable to control the psychic energies. They're always thinking high or something. Their basic needs are not meeting. So one has to keep the balance of the psychic movements and the response also very important. And the fifth most important, the reference to the immunity related issue also, most of the scientific studies proven that there is a balanced sleep should be there for the appropriate age people. For example, if I, being a person of the middle age, if I am going on sleeping, I'm unable to meet the sleep for the prescribed duration of 5 hours per day. If I'm just keeping 3 hours, 2 hours only, it repercussion will be there on my body. So most of my psychic functions are a little bit disturbed, and my immunity levels are also down. Several studies proven that there is a balance between the sleep and wakefulness people who are getting sound sleep, their what is called as the immunity levels are very high. So balance of sleep and wakefulness is also very important. For last point, what the previous speakers was talking about, evacuation and retention. In our science, there is a big chapter which is dealing about the disease of obstruction, where the matters which are residing in the body, which are supposed to be eliminated, if they are not taking shape, we are not appropriately not getting evacuated, all such matters will be residing inside the body into the channel through which they have to come. If they stay there for a long period, as a result, it leads to stasis, and again, different diseases are likely to be caused. So, and the principle of a treatment also, we just follow the holistic approach of a treatment, not like the conventional people say about the reductionistic approach, like my previous speakers are also talking about that. Any problem, if it is a matter involved there as a causative substance, here the matter stands for any of the what is called as the humor, the health, dosha. We start giving the treatment with the conscience, followed by conations, and there is a principle which lies that we will give some sort of a laxatives also. So the substance which is there in the body should be get appropriately cleaned to be come out of the body. And for that, the specific drugs are there, like phlegmatic laxatives, that what is called as choleric laxatives, and specific drugs will be prescribed based upon keeping both the temperament, misage of the patient and the nature of the disease what they are suffering. So we pay much attention about the importance of that prophylactically as the therapeutically on the asbab sitta daruriya, the 6 prerequisites. Modulation is required whenever it is required. If a person keep all these 6 essential requirements into control, most of that we can say their health will be very intact. They are not likely to be develop any infectious disease, nor they are prone to develop any metabolic or lifestyle diseases. So apart from this natural physical phenomena like this element, constitution, and the body fluids, their the faculties, parts, etc., one has to pay importance about these 6 essential prerequisites, without which nobody's health will be intact. If any imbalance is there, that can lead to disease. So one has to pay attention about the doing regular exercise, controlling diet, and one thing which I suppose to present before the people is Unani science says that when you are giving instruction to the patient for drug or any lifestyle modification, also you have to focus on some of the things like the person age, the gender, their what is called as their strength, and the area where they are living, the time of the administrating, suggesting the drugs, and this one, and the seasons of that area. And like friend was talking about, he suggested about the native use of the drug, what is the foods and the vegetables. Sometime, of course, it is proven that the things which are near to indigenous sources of things are very good for the people living in that area. So Unani pays attention about the cities, the seasons, the foods, and their qualities. All those things are there. Irrespective of the geographical affiliation of the people, if people follows the 6 essential requisite based upon their other requirement, if they modulate appropriately, their health will be intact. This is what my submission from Arvind.
Thank you very much. Thank you. That was beautiful. Finally, we get to yoga, and Dr. Subramania, what would be the maybe visible or feelable or in any ways signs for a misfunction in your system?
Yeah, as yoga is mind-body connection, and as we move our body or our parts of the body, along with that, mind also has to follow. That is, which is regulated by breath. So breath connects body and the mind. Along with the same, it is a Ayurvedic concept, ahara and vihara. So these two, along with the food, ahara is food. Along with the food, vihara, the activity or the occupation or whatever we do.
seems we have a breakdown of the of Dr. Subramania's internet connection. I hope it's going to make it back. So so far we can understand. We could have some ideas and diagnosis judging by the breathing patterns of a person, and yeah, I mean, we will go deeper into that once we have Dr. Subramania back, but he seems to have fallen out. So just as a short recap, if he can make it back in, then that's great. If not, we will do the recap and go into our break. So just as a short recap, all the experts told us it would be helpful to watch your body. It would be helpful to go into details. It would be helpful to especially watch your digestion, not only just whatever happens in the toilet, in the about your bowel movement or urine or all those things, but everything about your digestion, how you feel once you eat, how you feel after you sleep, how you feel. I mean, all these things add up. And once you have some sort of baseline of your healthy body, once you have some idea of yourself being in proper shape and in balance, which is hard enough. Nowadays, we see so many people who seem not to have the right idea of themselves, so, or the right idea of their bodies or of the capabilities of any body. So once you have a certain baseline, it can be established by yourself. It can be established with the help of any kind of experts that you trust in. But once you have that and you have any movements away from that baseline, then basically, you know, something is off. And I know many people nowadays in these fast-paced times are used to being, you know, half functioning. You know, they are used to have some parts that are just not quite working, but this is not the way it should be. So just get everything working. It's possible your body can work, your mind can work, and we heard many very useful ideas how you could handle that, how you could manage that, how you could observe your own health, and also how you can find probably everywhere you are the right people to you know, give you advice or take care of it. Also on that note, because Dr. Subramania seems to have fallen out, before we go to a break, some might watch these talks and think to themselves, you know, Unani medicine or Siddha medicine or Ayurveda, this is, it sounds so interesting. Coming later, maybe naturopathy, maybe we have so many different TCM, so Chinese medicine, Tibetan medicine, Persian medicine. And I have no access to them because I'm in Europe, in America, wherever. now with this knowledge festival, at least you know what these systems are talking about, and you might now have a set of names, a set of institutions, and places where you could find these experts. Also on our website, we have people on our advisory board. We will have, we'll build up a database of people we are working with. So just if you're interested, please get in touch with all these people, you know. You can reach everybody and at least get some advice as far as it's possible online or over phone, but obviously most of them work best once they see you in person. But just to build up awareness, you can reach these people. All these things that you thought maybe were extinct or no more part of this world, they're still here functioning and even moving on, developing. As you can see, all these medical systems are doing research, are doing case studies, are moving on, developing more and more drugs and medications and treatments. So please just take into consideration whatever your ailment may be, whatever may be torturing you in ways. There might be some solution to that outside of your boundaries. So just don't give up on yourself and go out and ask more people. And as you can see here, there are different systems, there are different points of view, and we hope to bring people together so much so that they find out ways to combine and unify their systems. So for now, Dr. Subramania has not come back. It was a great discussion. I thank all our experts, Dr. Mukesh, Dr. Senthil, and I mean, Dr. Subramania fell out, but Dr. Aleemuddin, who gave us a deep insight into Unani's working. And we'll go on a break for an hour and be back for the second round today. Thank you very much to everybody.
Thank you.
And
Thank you.
bye for now.
Thank you.
See you then.
Thank you.